Alterations in regulation and metabolism. Diabetes mellitus. Diabetes mellitus is a chronic metabolic disorder of the pancreas that affects carbohydrate, fat, and protein metabolism. It may be a consequence of metabolic syndrome that includes abdominal obesity, hypertension, an elevated LDP, triglycerides, and blood glucose levels, along with a low HDL. Of those that have diabetes mellitus, 90 to 95% acquired the disorder as an adult. It is the seventh leading cause of death in the United States, and 23.6 million people in the United States have diabetes mellitus, and this is an estimated number. The incidence is increased among African Americans, Latinos, Native Americans, and Asian Americans. So true or false? Diabetes mellitus is a disorder of the pancreas affecting sugar metabolism. This is false. Remember, it's a disorder of the pancreas that affects carbohydrate, protein, and fat metabolism. There's two main types of diabetes. Type 1 used to be called juvenile diabetes and insulin-dependent diabetes. It's caused by a lack of insulin production, and it usually occurs in people younger than 20 years, although it isn't specifically designated to that age group. Type 2 used to be called non-insulin dependent diabetes mellitus, and it's caused by insulin resistance. It may or may not require insulin injections, and it's most common in 45 to 64-year-olds, although it is now being diagnosed in obese children. Prediabetes mellitus can lead to type 2 diabetes, heart disease, and stroke. Risk factors will include being overweight or obese. Diagnosis is made by one or more abnormal blood tests. This would include a hemoglobin A1C of 5.7% to 6.4%, a fasting blood glucose of 100 to 125 milligrams per deciliter, or oral glucose tolerance test of 140 to 199 milligrams per deciliter. Prediabetes can be delayed or avoided with weight loss and increased physical activity. Hyperglycemia is an elevated blood glucose level. It may be associated with pancreatitis, excessive adrenal cortical hormone secretion or administration, or some medications or treatments. It might require the use of insulin, but it does not indicate diabetes mellitus. The function of insulin let me start over here. Insulin functions by carrying glucose into the body's cells. And it also helps promote the liver's storage of glucose as glycogen. It inhibits the breakdown of glycogen into glucose. With type 1 diabetes, the islet cells in the pancreas no longer produce insulin, and this causes an elevated blood glucose. It also causes the body to break down fats and proteins into energy. Lipolysis is that process of breaking down fats, and it produces ketones. An accumulation of ketones can lead to metabolic acidosis or ketoacidosis. The body will attempt to self-correct ketoacidosis with Kussmaul respirations, which are fast, deep, and labored breathing to help blow off the extra acid. The ketones have a distinctive fruity odor on the client's breath. Complications would include circulatory collapse, renal shutdown, and death. It is considered to be an autoimmune disorder, but it's also been known to be a result of viruses. Studies and trials are being conducted that may improve treatment of or actually cure diabetes. Type 2 diabetes mellitus is considered to be an inherited disease with risk factors including intra-abdominal obesity and a sedentary lifestyle. With these clients, insulin is produced, but the body is no longer able to utilize the insulin effectively, or less insulin is being produced. High serum glucose will pull fluid into the vascular system, causing polyuria. And because so much urine is lost, the client will experience increased thirst or polydipsia. Due to the body not using glucose as the fuel source, the client is going to be hungry and experience polyphagia. True or false? Type 2 diabetes mellitus occurs as a result of lack of insulin production. That's false. That's type 1 diabetes. Type 2 occurs because of insulin resistance or insufficient insulin production. The three classic symptoms of diabetes mellitus are polyuria, polydipsia, and polyphagia, in addition to weight loss, weakness, thirst, fatigue, blurred vision, and dehydration. These clients also have an increased risk of infection because glucose supports bacterial growth. There's also an abrupt onset with type 1, and there's a gradual onset with type 2. Gerontological considerations will include an increased risk of dementia, an increased side effect of hypoglycemia in relation to any diabetic medications that are administered. We may see glucose or ketones in the urine, and blood sugar tests, whether they're random, fasting, postprandial, which is 2 hours after a high-carb meal, oral glucose tolerance test, glycosylated hemoglobin, which is the hemoglobin A1C. All of these are going to reveal glucose levels that are elevated. With the hemoglobin A1C, it will reveal glucose levels for the past 120 days. Treatment is going to depend on the type of diabetes. We know that tight blood glucose control will help prevent future complications. Diet and weight loss are major components of treatment. Diet may be enough to control diabetes type 2, and it will be dependent on the gender, age, height and weight, client activity, their occupation, their overall health status, and their culture and dietary habits. The diet should include 3 meals and 3 snacks, so we can help keep those energy levels consistent. Exercise will reduce the need for insulin because exercise enables muscle to take in glucose without insulin. It also improves blood circulation and increases the risk of hypoglycemia. Insulin is another treatment that might be used. All clients with type 1 diabetes must use insulin. And it's important for nurses to be familiar with the type of insulin, their onset, peak, and duration. Injections with needles, pins, jet injectors, and pumps can all be used depending on the client and type of therapy prescribed. It's important to tell these clients to alternate the areas of injections to avoid lipoatrophy, which is the breakdown of subcutaneous tissue, or lipohypertrophy, which is the buildup of subcutaneous tissue. Alternatives to injections are being developed. Oral anti-diabetic agents are only used with some type 2 diabetics. And some of those type 2 diabetics may also require some insulin. Bariatric surgery might also be an option for weight loss with some type 2 diabetics. Pancreas or islet cell transplant may allow for some insulin independence. It is possible only with the type 1 diabetics. And islet cell transplants are usually only effective for about 2 years. Gerontological considerations would include a decreased taste that might lead to hyperglycemia. They just don't realize how much they're taking in because they don't have those taste buds. And decreased vision can also lead to inaccurate insulin dosage. Nursing management would include teaching or reinforcing diabetic care, including disease process, their diet, exercise, medication regimen, and administration, in addition to the monitoring of glucose, inspecting their feet daily, routine appointments with their provider, and routine eye exams. Diabetic ketoacidosis is a type of metabolic acidosis, and it's caused by an accumulation of ketones because of insulin deficiency or a client's inability to use insulin. It's often seen with hard to control diabetics, noncompliance with treatment, or infection. These clients may have undiagnosed diabetes when they're admitted with DKA, also known as diabetic ketoacidosis. This might be the first time that they realize they have diabetes. These clients will be weak, very thirsty, anorexic, may have vomiting, drowsiness, abdominal pain, those Kussmaul respirations, a low blood pressure with a weak and rapid pulse. Their blood glucose will be elevated, and their urine is going to have elevated glucose and ketones. And their blood pH is also going to be low. Treatment will depend on the severity of the DKA. The main goals will be to reduce the elevated blood glucose, correct the fluid and electrolyte imbalances, and clear the urine and blood of ketones. We're going to do this with IV insulin. It may also require glucose before their acidosis is completely corrected. We're also going to administer large volumes of isotonic fluid. Potassium replacements will be the other. Nursing management includes monitoring the vital signs, blood glucose, heart rhythms, and urine output. True or false? Diabetic ketoacidosis results from a client being a brittle diabetic or noncompliance with diabetes treatment. This is true. Remember, the brittle diabetic is the diabetic that's hard to control, or they're just non-compliant with their treatment, and it will typically occur in the type 1 diabetic. Hyperosmolar hyperglycemic nonketotic syndrome will be hyperglycemia without the ketones. So it results from a serious illness, diuresis. We see a blood glucose over 500 and a pH that's within normal ranges. It is more common in undiagnosed diabetics or type 2 diabetics. We're going to see hypotension, mental changes, extreme thirst, dehydration, tachycardia, fever, and neurological symptoms. These clients will have elevated blood glucose and serum osmolarity with a decreased serum potassium and sodium. We're going to treat it with insulin administration and correction of the fluid and electrolyte imbalances. Nursing management includes monitoring the blood glucose, the neurological, cognitive, and fluid and electrolyte statuses. Hypoglycemia is a low blood glucose level. It might be an adverse reaction of diabetic medications, not eating or taking diabetic medications, not eating sufficient calories with diabetic medications, or exercising more than usual. and alcohol. These clients will have nausea, drowsiness, hunger, malaise, excessive perspiration, confusion, coordination difficulty, and personality or behavior changes. A lot of times they will act like they're drunk. Their blood glucose levels are going to be low, and we're going to use maybe the glucometer test to determine this or a lab test. We treat it by administering 15 to 20 grams of a simple carbohydrate as soon as possible, preferably orally. But if they're unable to do oral, we may have to administer glucagon or IV administration of 50% glucose. After we correct their hypoglycemia, we want to administer complex carbohydrates to help keep their blood glucose levels up. Nursing management includes monitoring their blood glucose and encouraging the client to eat within 15 minutes of insulin administration, in addition to encouraging regular meals and snacks. Neuropathy is a pathologic change in the nerves. It can come about from poor glucose control, decreased blood circulation to nerve tissues. Motor neuropathy will be weakened and/or atrophied muscles. Sensory neuropathy are paresthesias, up to total loss of feeling. And autonomic neuropathy will affect nerves to the organs. These clients may have pain, swollen feet, disturbing sensations like pins and needles, or no feeling at all. They may have digestive, urinary, or sexual dysfunction, dizziness, and smaller skeletal muscles. We determine this through neurological examinations, screening tests, or electromyography. We treat it with diet and exercise to help control their blood glucose, pain relief measures, drug therapy, antibiotic therapy, or drugs to reverse diabetic neuropathies. Nursing management will include client education about the prevention of neuropathies and encouraging adherence to medical regimen and proper foot care. Gerontological considerations will include good foot care because of other comorbidities. These pictures on the screen, they're doing a monofilament test to determine feeling. It's basically a stiff little plastic filament that should produce kind of a sharp sensation when touched to a toe or the bottom of the foot, etc. And then the bottom picture shows a diabetic foot ulcer, also known as a DFU. These diabetic foot ulcers are usually dry. They're usually pretty round in shape like this. And a lot of times the client doesn't even know it's there. Diabetic neuropathy is the progressive decrease. It's diabetic nephropathy. Is the progressive decrease in renal function. Excuse me. Glomerular deterioration might be the cause, and it's usually seen along with retinopathy and vascular changes. The client may have poor glucose control and high blood pressure that helps contribute to the development and progression of this issue. These clients may have swollen feet and hands, a gradually increasing blood pressure, tiredness, and weakness. The serum creatinine test, renal creatinine clearance test, and albumin in the urine might all be tests that are done to diagnose this issue. We're going to treat it by controlling blood glucose levels and high blood pressure. We do this with drug therapy, dietary protein reduction, and smoking cessation. Remember, smoking causes vasoconstriction, which increases blood pressure. Nursing management, we're monitoring blood sugars and blood pressure, providing client education on rationales for their medical regimen, and encouraging routine follow-up appointments. Diabetic retinopathy will be the pathologic change in the retina because of diabetes. We see vascular changes in the retina due to poorly controlled blood sugars. It may be non-proliferative, which is the milder form, or proliferative, which can cause blindness. The client will have diminished visual acuity. They need to have ophthalmic examinations routinely, maybe even a fluorescein angiography to diagnose this condition. We will treat it with routine eye examinations, maybe laser photocoagulation, a vitrectomy, or ACE inhibitors. Nursing management includes encouraging therapeutic regimen for tight glucose control and client education on the complications of diabetes, along with regular ophthalmic examinations and adherence to their medication regimen. All arteries and arterioles are going to be more susceptible to atherosclerotic or arteriosclerotic changes in the diabetic client. This is caused by a thickening of the arterial walls and an increased incidence of coronary artery disease or hyperlipidemia. These clients may have pale and cool extremities, leg cramps, gangrene, skin ulcers, and myocardial infarctions. We will see elevated triglyceride levels. We may end up doing an angiography or Doppler ultrasonic flow studies to determine the blood flow. We'll treat it by initiating lipid-lowering measures, administering vasodilators or platelet aggregation reduction drugs. These clients may also require amputation. They may have insulin or other anti-diabetic drugs. Nursing management includes encouraging smoking cessation, client education on diet, exercise, and their medical regimen, along with routine monitoring of their glucose levels.